Hey everyone, Peter from Team Sapiens PT here. I got a great response with the neck video that I posted the other day, so I wanted to bring in something else that I thought was interesting. So this patient I've been working with for the better part of a year, about once a month. Various complaints and problems and limitations that they are dealing with, namely bilateral knee and ankle pain. So again, process of trial and error, trying different strategies, different exercises has shown that improving his coordination at the hips, using different strategies to challenge his stability and balance have resulted in improved symptomology and not feeling the pain that he was in certain situations in his knees and ankles. This person is particularly interested in the Turkish Get Up. So he said he was having problems with that. I'm by no means a Turkish Get Up expert, so if I label any of the movements wrong or transitions, feel free to correct me. But I watched him go through the series a few times, and essentially the hang-up was somewhere from transitioning up. He would get to this point, no issue, but he had a really hard time going from here to the lunge position. So I had a hard time verbalizing exactly what the issue was for him, but after watching a few times, it seemed like rather than getting his hips and shoulder directly under the weight that he was holding overhead, his weight was getting transferred further away from his hips, and that creates a moment both at the shoulder because the weight travels further away from my hand, and then I rely more on my knees and ankles to do the motion and don't really get to utilize my hips as much. So I started playing with the motion with him to figure out how we can make that transition a little bit better. And this highlights an important principle that I tend to use a lot in therapy in terms of motor learning, which is practicing a part of a task and not the whole thing. So identifying wherever the hang-up may be and drilling that over and over and finding out some sort of cue that might be helpful for them. So for him, again, he tended to lean forward and transfer his weight more towards his knees and his feet, which kind of got the task accomplished. It just wasn't the most efficient way. By practicing the movement with him, I noticed that he had to transfer his weight back in order to be able to clear this leg comfortably and more efficiently to be able to get up into this position. So the drill that I had for him was to avoid putting so much weight forward. I asked him to get into this position but lift his front leg up. So that automatically transfers the weight back onto this leg and gets my hips more directly underneath the weight overhead. So again, to highlight that principle of motor learning, that's where the hang-up was. So we broke the task up into one component, had him drill it over and over and over. He started feeling things in new places that he hadn't before, not necessarily the symptoms that he was getting in the knees. And that really helped him make that transition much easier versus the first scenario where he was kind of having to break it up into pieces and it just looked less efficient. So the Turkish Get Up might not necessarily be something specific or relevant for you, but the principle that I want to highlight again is breaking up a task into component parts. Practicing wherever that breakdown is can be further integrated once you practice some drills and making the whole movement look smoother. So if you have a hard time identifying something personally that a movement that you're struggling with and you're having a hard time identifying where the hang-up might be, talk to a physical therapist. Reach out to me. I will leave my email in the description for you guys if you have any questions, suggestions for future videos. I'll keep sharing things that I think are interesting that you might find interesting. Hope you learned something. Thanks for watching.